I would like you to appreciate how I, along with the patient, arrive at the most appropriate dental treatment. Let's look at this young woman who had some serious dental concerns and follow her experience. On the left, you'll notice my perspective, and on the right, you'll notice the patient's perspective. Although she was only 25 years old, she already had extensive orthodontic and periodontic treatment. Her 8 years of orthodontic therapy included a palate expander, some extraoral headgear, bracket and wire therapy, as well as retainers. At age 23, she had a first free gingival graft in the mandibular anterior or lower front portion of her mouth. The periodontist is her triaging dentist. She is presently not under the care of a general dentist. Her main concerns were her teeth were sensitive to cold and she had pain in the jaw joints. We needed to determine whether the pain in her teeth were causing the jaw problem was causing her teeth to be sensitive, or we had two separate dental issues that needed to be addressed. Her periodontist had recommended 4 additional gum graft surgeries. Her orthodontist had recommended retreatment of her mouth, and that would include brackets, wires, and elastics. She was told she was not a candidate for Invisalign. She was told there was a potential to have some first premolars extracted, and the periodontist had said she would probably require 4 to 12 porcelain veneers. Why did she seek a second opinion? She was not sure that she wanted to have 4 more gum grafting surgeries. She was not confident that this orthodontic therapy would yield significantly better results. She was not comfortable with the thought that her teeth would need to be shaved down so she could have porcelain veneers. She did not like the fact that the removal of some teeth were being considered for her orthodontic therapy. And the cost estimates for these treatments were significant. My recommendation was for Invisalign removable orthodontic therapy. I also recommended teeth whitening. I was recommending enamel remineralization as well as desensitization to make sure her whitening therapy would proceed as comfortably as possible. This was the digital panoramic X-ray of her mouth. Due to the sequencing of her therapy, she did not notice much of a difference in her mouth for the first couple of months. However, at the end of her 7th month, the idealization of her arch form and the repositioning of her teeth led to a dramatic improvement. Her smile is gorgeous. While her smile looks wonderful, maybe more important, her mouth was pain-free in her mouth for more than 6 months. Follow the arrows and you could notice the tissue by the neck of her upper left premolar is now less red. The gum tissue is less puffy and is healthier than it was before. Let's look at further signs of improved health. Her teeth stabilized over the following 6 months while she wore the retainers for 22 hours each day. The gum tissues surrounding the necks of her front, side, and back teeth have all tightened up. Her gingiva, the gums, are continuing to mature and heal. The underlying bone physiology, the infrastructure of her mouth, has dramatically improved. The teeth are also responding nicely in their new and now stable positions. The lower front graft is clearly healthier than it was. Notice the improvement in the gums from the end of active therapy on the left photo when compared to her mouth 12 months later, after 6 months of full-time and 6 months of nighttime retainer therapy on the right. Notice above the arrows that the space between her top and bottom canines has closed. This occurred naturally. No bite adjustments were needed, no teeth surfaces had to be shaved down to have them fit just right. The photo after 6 months of full-time retainer wear is on the left. The photo after 6 months of nighttime retainer wear is on the right. Notice how the gum tissues continue to tighten and improve. Once again, look how naturally and beautifully the top and bottom left canine teeth now meet. She tries to give robust ear-to-ear smiles. She really does. She thinks that she smiles as wide as Julia Roberts. However, Her smile is much more modest and more closely resembles Eli Manning's smile. Let's review her projected simulation and see how it turned out. Let me explain what we are viewing in this compilation photo. The top left is the start. The top right was taken at the end of active Invisalign therapy. The bottom right was taken after 6 months of full-time retainer wear, also 22 hours each day. The bottom left was taken at month 19 after 6 months of nighttime retainer wear, approximately 6 to 10 hours each day. So when one asks, how long will the treatment take? One could answer 7 months, or 13 months, or 19 months. They're all right answers. I will let you decide. These arrows summarize how much healthier her mouth is now compared to when we started. It would not have been possible to obtain these natural and healthy results if the treatment had incorporated the extraction of teeth, periodontal grafting surgery, traditional orthodontic treatment with brackets, and porcelain veneers. So let's review. We had a lovely, energetic, and healthy young woman with multiple dental pains. We wound up with someone who no longer has to drink cold beverage through a straw, who no longer has that TMJ pain and the headaches that go with it, who did not have to have any teeth shaved down or removed. The same periodontist who performed her gum graft surgery has examined her. He has updated his opinions and her status. She no longer needs any of the 4 additional surgeries. Her teeth accumulates less stain, less plaque, and less calculus. The top tooth that was kicked out and pressed against her lip, and the one that was kicked in, now both fit beautifully. Her smile is symmetric and balanced. All of her teeth are now in full function. Her bite and arch forms are much improved and are very close to the ideal. Her teeth are whiter, her smile is more vibrant, and her smile is also age appropriate. The cost of the treatment was a fraction of what was proposed by her periodontist and the orthodontist. Let's remember where we started and where we ended up. This was truly a life-changing result.